Hello everybody. In this short video, we're going to be talking about some of the general information that you need to know about norepinephrine. First of all, when norepinephrine is being produced endogenously, it is derived from dopamine, and dopamine is derived from tyrosine. And when norepinephrine is given to the patient exogenously, or when it is produced endogenously, it can affect both alpha and beta receptor. But it has the greatest affinity for alpha-1 receptor, meaning that it is mostly affecting alpha-1. And norepinephrine is a catecholamine. Therefore, it cannot be given orally, but it can be given parenterally by IV. It cannot be even also given subcutaneously, and the reason for that is basically the high affinity of norepinephrine to alpha-1 because it is causing extensive vasoconstriction. So if you give it subcutaneously, it will cause localized vasoconstriction. Even when it is given intravenously, it will cause a slowing of skin along the site of the injection. And norepinephrine is a substrate to both monoamine oxidase and catecholomethyltransferase. Therefore, it has a very short duration of action. So now let's see what does norepinephrine do to the systolic blood pressure, diastolic blood pressure, heart rate, and total peripheral resistance. Basically, since norepinephrine has the highest affinity for alpha-1, it will cause extensive vasoconstriction and it causes an extensive or a massive increase in the blood pressure and total peripheral resistance. The total peripheral resistance will increase and both of the blood pressures will also increase. What about heart rate? Extensive vasoconstriction will sometimes cause vasoconstriction-induced bradycardia, so that heart rate will decrease. So now let's come to the uses of norepinephrine in the treatment of hypovolemic shock. To be honest, norepinephrine can be used in the treatment of hypovolemic shock, but as a last resort. Because what is the idea of shock? The idea of shock is we have hypotension with tachycardia. It means norepinephrine is solving both of those problems for us. But since norepinephrine is causing extensive vasoconstriction, including the renal circulation, it will lead to decreased blood flow to the kidney and it will cause renal failure. That's why in the treatment of hypovolemic shock, the treatment of choice is dopamine. And after dopamine, we may be using something like metaraminol. And then as a last result, if nothing works, then we are using norepinephrine. And the reason, like I said, is the risk of renal failure. So that's all. Thank you very much for watching. And please like this video if you find it useful.